At the University of Michigan Survival Flight, a great deal of time and effort is invested into training. Training in aviation, clinical skills, decision-making, as well as training for emergencies such as how to survive in the wilderness encompass our curriculum. The training starts during orientation and continues in the form of recurrent education throughout the flight nurse's tenure at Survival Flight. We train as part of our professional commitment. We train in order to increase our level of knowledge and scope of practice. Most importantly, we train so that we excel in our high-stakes, high-risk environment. The model of education and training that we use is in the form of an apprenticeship. As Alan Collins et al. Explains when discussing the concepts of cognitive apprenticeship, an apprenticeship allows the learners to see the process of work. In this process, the learning and the activity is visible. In our practice, there is very little room for theory or abstract concepts to interpret. However, this does not suggest that there is little importance to didactic education. In fact, it is the foundation for clinical practice. The challenge then becomes translating this acquired knowledge during static case review, journal clubs, and classroom lecture to problem-solving, skill acquisition, and clinical decision-making. The aspects of a traditional apprenticeship, such as modeling, scaffolding, fading, and coaching, work well in the survival flight training program. In the military, this was more crudely described as see one, do one, teach one. While there is a great deal of accuracy to this, I like to think that there is a bit more science to our methods. Regardless, as Collins describes, learners have constant access to models of expertise in use against which to refine an understanding of complex skills and situations. Meet Sandra, one of the newest additions to the Survival Flight team. She has an extensive and broad range of experience as a clinician. She is bright, articulate, personable, and highly motivated. When I sat down with Sandra last week, I was very much interested in her experience as a Survival Flight nurse orientee thus far. I wanted to know how best to help her translate her existing knowledge and skill set into what is needed in order to excel as a flight nurse, arguably a much different environment than where she came from as a nurse in the pediatric intensive care unit. What Sandra verbalized to me is that while her bedside nursing experience is very valuable, caring for patients at outside facilities in the back of a transport vehicle is considerably different and quite intimidating. Hearing this, I realized that what I needed to do was to help create scaffolding in order to allow her to bridge what she knows into appropriate action in a relatively austere environment as compared to what she is used to. This is a story of a day in the life of a survival flight orientee and how education and training translates to life-saving care during high-risk patient transport. We started the day with several exercises that would provide Sandra the opportunity to problem solve at a manageable pace and amend decisions as needed. This was simply a chalkboard exercise where the orientee is given a patient problem and then asked to write down on the board everything that they decide, assess, implement, and modify. The purpose of this is twofold. It allows the participant to make changes on their own as all of their decisions and mistakes are in front of them. It also allows for appropriate debriefing as both teacher and orientee can clearly see the decisions that the orientee made, which can be powerful in training novice clinicians how to problem solve and make better clinical decisions. In this exercise, Sandra was given a patient having a heart attack. In the scenario, the patient's condition decompensated and she was tasked with figuring out why, given physiologic parameters and diagnostic indications. Based upon the existing framework of prior knowledge and current survival flight management protocols, she was tasked with problem identification, etiology, and appropriate management within the context of the patient transport environment. Sandra admitted that during the exercise, she had the basic concepts but was lost at times on how best to handle this complex patient management and transport situation. While the process had been made visible to her, she seemingly understands the relevance and importance. The clinical issue is that she is having difficulty translating existing and newly obtained knowledge into a different situation. A teachable moment has been discovered. Later in the day, we transferred our training to a more complex setting. In survival flight, we often train utilizing high-fidelity human patient simulators. These lifelike mannequins breathe, talk, blink, seize, and display physiologic signs of ventilation and perfusion. During simulation, heuristic strategies, or tricks of the trade, and control strategies are modeled and practiced in a safe learning environment. Participants are allowed to make mistakes and learn before ever performing some of these same actions on a live patient where arguably the stakes are significantly higher. The goal of this session was to assess the results of my coaching earlier in the day. By providing scaffolding in the form of deliberate teaching and assessment in a different yet diverse environment, it was my hope that Sandra would translate what she has learned to a different situation. Collins et al. Calls this articulation in the setting of a cognitive apprenticeship. Following each scenario, reflection occurs in the form of debriefing. This allows for additional coaching, and it allows the student to reflect on what he or she needs to improve upon, with the eventual goal of individual problem-solving and critical thinking skills. It allowed Sandra to conceptualize the whole task of patient management before worrying about individual tasks that sometimes get lost, especially in a more complex patient management scenario. During the simulation session, Sandra was given a much different and more diverse care scenario. This was an adult trauma. However, this trauma patient had components or problems that we have already explored. This was a much more complicated case than what she was previously given during our chalkboard session, but many of the same assessment and management strategies applied. She was required to perform a thorough history and assessment, review key diagnostic studies, and formulate an appropriate treatment and transport plan. It was great to see Sandra not only handling a much more complicated case, but applying the previous learning goals to this case, showing that she was able to articulate existing knowledge into a variety of situations. In my mind, a higher degree of problem solving was taking place for her. Later in the day, we received the call to action. An adolescent male was gravely ill with a life-threatening infection and needed emergent stabilization and transport to Mott Children's Hospital in Ann Arbor, Michigan. Prior to our arrival at the patient's bedside, we reviewed what we had discussed throughout the day, our preliminary management plan, and the ever-looming what-ifs to the transport environment. As we approached the patient's bedside in the intensive care unit, it was clear that prompt and deliberate action was required. As a direct result of her experience and training, Sandra was calm, employed appropriate problem-solving strategies, and managed this complex transport very effectively. This transport was the final piece to Sandra's learning on this day. She was provided a realistic environment in the context of her actual job. She worked with a team to accomplish particular tasks and objectives. She realized that there was more than one way in which to accomplish these objectives, and she created motivation for herself as she realized that this job was one in which she was made for. The social characteristics of her apprenticeship learning environment was made apparent. She excelled because she was an active participant in her own learning, and success was measured by the safe transport of this critically ill young man.